world of testicle enhancement, I find, has really been left behind as opposed to, let's say, breast enhancement. We've had many different generations of breast implants. We've lots of research that goes into that. However, the world of testicle implants, for either folks who have lost a testicle or folks who want to enhance their natural testicles, it's been a little bit left behind. However, in recent years, we have made some progress, and it's interesting, in the plastic surgery world and the urology world, we can do things a little bit differently, but thankfully we're kind of coming together to agreement on some of these things. So in this video, I'm going to talk about 3 things I do not do in my practice when it comes to testicle enhancement or testicle implants, and the reason why. So number 1, a wraparound prosthesis. So in some cases, in order to increase the size of the testicle that is there, in some practices, they will do a hollow implant. So basically an implant that has room on the inside for the natural testicle in order to try and make things as natural as possible. I don't like to do this in my practice because I'm a firm believer that if the testicles are still in there, they need to be accessible. It is possible to develop a lump in the testicles, and so we want to be able to examine and or ultrasound that testicle, screen them, make sure everything's okay, because thankfully it is rare, but testicle cancer does still happen even in the over 40s age group as well. So what we do is what's called a side-by-side technique, or really a better way to explain it would be in front and behind technique, where we usually use the new testicles to push back the native testicles. We use an implant that's big enough to hide them if they're still in there, and in this way, in a normal resting position, you're not able to see the natural testicles, but you can access them to examine them if needs be. Number 2, what your testicle implant is made out of. So in the United States, the most common testicle implant is still saline. We had silicone implants in the past that were taken off the market in the early 90s. There were some scares around them. Most of that was debunked. However, they never came back really on the market widely for use. And so saline implants, unfortunately, I find tend not to be very well tolerated. They're very firm, they don't feel natural, and in one study, for example, I think it was out of Scandinavia, about 70% of patients who had them didn't tolerate them, and it's a very common reason that patients come to my practice in order to have them switched out to these softer silicone type implants that I prefer. The silicone implants have improved. We're on to the extra soft durometer implant, and they tend to be extremely well tolerated by patients. So in my practice, that's exclusively what I use. Now, the third thing I do not do in my practice, and again, I see it a lot, is I don't fix the implant into position. In the plastic surgery world, this is a little bit of a strange thing to do, because if you think about it, we put in breast implants all the time, and with the exception of some reconstructive devices, we don't fix them in place, and we prefer them to be able to move naturally within the body. Because if you think about it from an anatomical point of view, there is no natural anchor between the testicle and the scrotum itself, whereas on especially the saline devices, you'll see a tab there that is sometimes used to fixate it, and it tends to make the testicles move unnaturally and also cause a dimple that is bothersome to patients as well. So we don't even have that tab in the silicone implants we use. I don't recommend using it. I think the urology literature does agree with this now in general, and so therefore we don't fixate the testicle implants. So some progress has definitely been made in this field. Unfortunately, like I said, it can tend to be an afterthought, because in folks, for example, who've had testicles removed, let's say for cancer, kind of focused on the cancer end of things. We're not really thinking so much about the patient's psychological welfare in some cases. Some studies have been done that show this. It's not just me talking anecdotally. And really we need to do better, and there are thankfully now very good reconstructive techniques available. And of course, for folks who want to enhance the testicles as well, this field is growing, and thankfully the devices now are a lot better.